we'll handle that, and we could start now, and then we'll get that double check.
Okay, thanks.
Yep.
All right. Well, thanks everybody for coming to our August Barrier Busters meeting. We'll get started right away. Our first presenter is Alicia Curley, the Friends of Life Program Coordinator over at the Humane Society of Huron Valley. So if you'd like to get started, that'd be great. Thanks, Alicia.
Yeah, thank you so much. So, hi everyone. Thank you for having me. I'm excited to share with you about the Humane Society of Huron Valley's newest program called Friends for Life. Just first, a quick introduction. So I'm Alicia Curley. As mentioned, I'm the new program coordinator for the Friends for Life program. I started in March as an employee, but prior to that, I was a volunteer, primarily helping with dog walking and laundry, and being able to see the impact firsthand that HSHV had on animals and people in the community really inspired me to pursue a staff position, especially one that's dedicated to protecting the bond between people and pets, which we'll talk about as we talk a little bit more about the program. I did want to do just a very quick intro of the Humane Society as either a refresher or, some information if you haven't heard of us. We are an animal welfare organization, and we are the only animal shelter in Washtenaw County. One of the things that I found most interesting when I started as a volunteer is that we're not actually affiliated with any other humane societies. So we're not affiliated with Michigan Humane or the Humane Society of the United States. We actually are an independent organization. And you can think of Humane Society more like a term like hospital. So it's really more of a phrase that helps people identify what an organization does. It doesn't mean that we are all connected. So again, we are an independent 501c3. And we are really excellent at what we do. We're rated exceptional from Charity Navigator consistently, and we also have a lot of really rave reviews from folks who have either adopted from us or have received services from us in the past. Our mission is to support the loving and responsible care of animals in our community, and we do that in a variety of different ways. So we're most known for adoptions of domesticated animals such as dogs, cats. We also have rabbits and guinea pigs and the occasional pigeon. But we also have a full service veterinary clinic. Our clinic is an outpatient clinic that's open to anyone, so you do not have to have adopted from us to get veterinary care with us. We also have a cruelty and rescue team that not only investigates concerns of animal welfare and animal abuse, but they also rescue injured wildlife. We have a variety of people-focused support programs, which we're going to spend the majority of our time talking about. But we also have a humane education team, which primarily aims to help youth learn to respect and build empathy for animals. And then we also have an advocacy team, and they work really hard to bring awareness to the community on issues that impact animal welfare. So we do a lot at the Humane Society, and again, we really are trying to promote the loving and responsible care of animals in our community, but we also want to help the people that have those animals too. So we have a variety of people-focused resources that are available to folks in Washtenaw County. I'll cover a few of these pretty quickly, but then I want to dive deeper into the Friends for Life program since that's what I'm here to chat about. So we do have a trap, neuter, and release program, and this program helps feral or community cat colonies with low-fee spay, neuter, and vaccination. So we will help provide traps, humane traps for trapping community cats. We will spay and neuter them, vaccinate them, and then help return them back into the wild. So if you have clients who are supporting a family of cats outdoors, this is a really great program to help ensure that those cats are getting care, but that we're also not increasing the cat population out in the wild. We have senior discounts that apply to everything throughout the shelter, from adoptions to veterinary care. We also have free senior to senior adoptions. So folks 62 or older can adopt a dog 8 or older or a cat 12 or older for free. We also have adoption discounts for military service members and veterans. So we do try to make adoption accessible, especially to those who could really benefit from an animal pal. We have our Bountiful Bowls program, which provides supplemental pet food for those in need on a monthly basis. There are income requirements for Bountiful Bowls, but folks can either pick up the food at our location on any given Sunday in the month. But we also deliver through Meals on Wheels Ypsilanti and Meals on Wheels Ann Arbor. So folks who are already enrolled in Meals on Wheels programs in those two cities can also get their Bountiful Bowls food delivered to their door, which is a really great way that we're making this program more accessible to the community. We have our Safe Harbor program, which I'll talk more about in a bit. And then we have our newest program called Friends for Life, which launched this past April, or just this April anyway. So Friends for Life is a program that's designed really to protect, improve, and extend relationships with animal companions. And originally this program was designed for seniors, but we also extend this program to folks with exceptional needs. So this could be folks who are experiencing homelessness, folks who are facing housing insecurity, folks who are going through an extreme crisis, or those who are just really, really struggling to care for their pet. We predominantly are helping seniors, but again, as I mentioned, this program really aims to support those who need the help. And it came about because we know that pets can be literal lifesavers, especially for seniors. We understand that the benefits of having a companion animal are immense, from the emotional support in reducing loneliness, depression, and anxiety, to all the physical health benefits like reducing blood pressure, to encouraging people to be more active. We also know that seniors and others who are often marginalized can experience a lot of difficulty in getting the support they need to keep their pet, right? So Friends for Life came about as an effort to do just that. This program really is the result of a grant from the Burr family who made this possible, which we're incredibly grateful for. It's in memory of Kathy and Ann Burr, who were pet lovers and animal welfare advocates. And without this grant, we wouldn't be able to do all of the life-saving things that we've already done in such a short amount of time, which I'm excited to share with you. Friends for Life focuses primarily on coordinating resources, with a large portion of this grant going to funding veterinary care for those who need it. We're also working to distribute essential pet supplies back into the community. So things like leashes, collars, litter boxes, litter. We're also piloting a pet care support program too, which I'll share a little bit more on that. But we really want to make supplies and vet care basic needs, right, as accessible as possible. And we also want to try and get those supplies out into the community as much as possible, because we know our shelter, it's a beautiful shelter, but it also is not on a bus route. And so we know that transportation out to us can be a little bit difficult. Through our Safe Harbor program, we can coordinate temporary housing for animals for those in emergencies, which I'll talk about in just a second. We can often provide personalized animal behavior advice through our behavior specialists. So if someone is struggling, sometimes we can give a little bit of insight and help there. And then last but not least, through this program, we can coordinate animal visits to those who are unable to have a companion animal. And as mentioned, we offer adoption specials, discounts, and consultations, especially designed for seniors who might be looking to bring a pet into their lives. So many of you might be familiar with our Safe Harbor program, but if not, it's an emergency shelter program that can provide temporary housing for pets in need. This is really for exceptional emergencies when someone does not have a neighbor or relative or friend who can kind of take their pet for a temporary amount of time. So up until now, this program really has been for urgent and immediate needs only. So for example, someone is rushed to the hospital and a paramedic or a social worker kind of informs our intake team that there's an animal that's left behind and they need emergency housing. With our Friends for Life program, we're introducing the ability to request temporary housing in advance of someone requiring it. So what this means is that if you have a senior who knows that they have a surgery coming up and it's going to make it difficult to care for their pet, they can reach out to the Friends for Life program. And what we will do is get as much information we can about the animal and then try and find a foster home who's willing to house that animal while that person is getting the medical care or attention that they need. This is a pretty kind of new way to think about our housing, temporary housing program. And one of the things that's helpful about it, aside from, giving someone the peace of mind to know that their animal is going to be safe while they're getting medical attention, is that this program also aims to bypass the shelter. So meaning animals that we can bring in through Friends for Life Harbor won't stay at the shelter at all. They'll essentially go right into a foster home, which reduces a lot of stress on the animal and reduces a lot of stress for the owner too. So this is again a newer program. It is dependent on space. And right now, our shelter is at capacity. So there's always the case that we won't be able to find a home, but we will always try our best to find a way to help somebody if we can. So just kind of a quick mention, we are always in need of more fosters, especially for this program. So if anyone's interested in fostering, I'm happy to provide more information offline. And it's also a way that I talk to seniors a lot about if they can't have a pet of their own. Fostering is a great way to have a companion animal without the necessary financial responsibilities because we take care of the veterinary care and the food. So fostering can be really great for seniors who are looking for companion animals too. So in short, on our harbor program, if the need is urgent or immediate, folks can contact our intake team. If the need is anticipated or in the future, you can contact Friends for Life and we'll do our best to try and help find temporary housing for someone's pet. There is no charge for this program, which is pretty amazing. And all of this information is also available on our website all the time. All right, so I mentioned that a big portion of this grant really is going towards veterinary care. So making veterinary care more accessible and affordable for those in need. In our outpatient clinic, we're doing this by often being able to discount or sometimes provide completely free veterinary care for sickness, illness, or urgent care needs for animals. In many cases, we've also been able to provide free dentals to seniors with senior pets who really need it. So if someone is a senior or someone who has no income or they're facing housing insecurity, has a pet that requires medical attention, they can reach out to Friends for Life and we'll see what we can do. I mean, in general, our clinic really does try to help provide financial support for those who can't have it, whether that's through programs like Scratch Pay or other discounting. But Friends for Life really is another supplemental way that we're trying to help folks who typically don't have access to vet care get it for their pets. We also know that wellness and preventative care for pets is in high demand, especially as the cost of living increases, and so does the cost of pet ownership. So we're working to make essential vaccines more accessible into the community. And one of the ways that we are doing that is through free vaccine clinics. We actually hosted our first one in July at First Baptist Church of Ypsilanti, and it was a great success. We vaccinated 48 dogs, microchipped 30 of them, and we provided all of that free to Washtenaw County residents. When we have events like this, we don't means test, so we really do encourage folks who know that they need the help to bring their pet, and we do our best to give that pet care that day. We also distributed 600 pounds of dog food to the Pet Pals Mutual Aid community through that event as well. Again, because getting essential supplies is one of the things that we want to do. And so we always try to make these clinics a way for folks to not just get vet care, but also to get other supplies and dog food that they might need at the time. We are hoping to have another free clinic before the end of the year, likely in Ann Arbor. So please stay tuned. I certainly will send out an email to the listserv when we get that scheduled and share the word because I know that this is something that is always in demand. Okay, something I'm really excited about is in-home pet support. This is something that we are piloting. It's not a fully launched program yet, but we're trialing it this fall. So it's a volunteer-led support program, and as part of this program, volunteers will be going into a low-income senior housing complex to essentially drop off supplemental dog and cat food, to provide dog walking support once a week, and deliver cat care kits, which will include new litter boxes, scoopers, and litter. In the future, we are hoping we can expand these services to include things like litter box scooping, but we're really excited to see how this pilot program goes and see how we might be able to develop it further for the community. Again, this program is designed to keep people and pets together for as long as possible. And so if providing dog walking support once a week is something that's really going to aid the owner and keep them together with their pet, we want to be able to do that. So with this pilot program, we're hoping it goes really well. We're hoping to get some good information and that maybe we can roll it out to other communities throughout Washtenaw County. And then lastly, I just want to mention that we do, we're always looking for different ways to connect with the community, right? And tell people about our program. We offer a handful of presentations that help educate and help provide enrichment, both for humans and pets. Our seniors and pets presentation discusses the benefits and realities of pet ownership for seniors. It discusses all of the resources available at the Humane Society. So that's kind of a really great 101. We have a creature crafts program, which is hands-on DIY, where folks learn how to make a dog toy, make a cat toy, and they learn all about cat and play behavior to have a more healthy relationship with their pet. It's great for all ages. It's a fun multi-generational activity and something that can be really enriching. And then our newest program, Pet Reminiscence Circles, includes a visit with a certified therapy dog. So we are partnering with TheraPaws, which is another nonprofit in Washtenaw County. And essentially, it's an hour-long session. It gives seniors an opportunity to socialize, to share memories of pets and animals, and really enjoy the comfort of a therapy dog. This is really great for existing memory cafes. I know a lot of local organizations host memory cafes, and it also works really well as a standalone session. But again, the idea is that we really want to bring the comfort of joy and animals to those without, and it especially works really well for folks who might have memory challenges and for the caregivers of those with memory challenges to bring a little bit of joy and comfort into someone's day. We certainly schedule programming at senior centers, assisted living complexes, just about anywhere that this might be appropriate. So please reach out if this is of interest. So to get in touch with us, there's a variety of ways that you can do it. We do have a website, we have a phone number, and there's a contact form on the website as well. Our email address is listed there, and then our phone number too. I'm in the office Monday through Friday from about 10 a.m. to 2 p.m. So my response times back are generally 24 to 48 hours during the business week. And given my limited time in the office, I will say that Friends for Life is not an avenue for emergency care. So if you're working with someone who has a pet who requires emergency medical attention, it really is best to either call our clinic for some advice over the phone or to take a pet to the nearest emergency vet. Similarly, again, if a client needs emergency housing for their pet, it's best to call our intake team for that Safe Harbor program. And I'm happy to open it up to questions, but before I do that, I'd regret it if I didn't share that we are having adoption specials through September 3rd. Adult dog and cat adoptions are free. So if you're working with anyone who could really benefit from the companionship of an animal, now is a really great time to visit our shelter and consider adoption. Okay, so now I'd be happy to answer any additional questions anyone might have. And yes, I think someone said, can I share the contact information in the chat? I absolutely will do that. All right, any questions going once?
I had a question.
Thank you
Yeah,
for
Just trying
this
to raise
wonderful
my-
information.
So we're in Manchester. I'm just curious if the in-home pet support is available to folks out this way. We're about 25 miles outside of Ann Arbor. So I don't know if you have in the in-home pet support for people in the rural Washtenaw County.
Yeah, did you say Manchester? I just want to make sure I heard correctly.
Yeah, Manchester.
Okay. Yeah, so right now our in-home pet support is a trial program only. So we're starting with one small location in Ann Arbor. So we're not yet launching it widely. That's not to say we won't, but right now it is just a pilot program. We do drop off though Bountiful Bowls food to Manchester. So if there are folks who need supplemental dog and cat food in that area, we already do deliveries out there. So I'm happy to share
Yeah,
that information with you if that's
Yeah,
helpful.
we have, I know that's through Manchester Family
Yeah.
Services and so we know to refer people there.
Awesome.
So, yeah. And remember us out here for the in-home stuff too.
I will, absolutely. Yes, I know it's high demand,
you.
so we certainly will make sure we spread the word on that too.
Perfect, thank you.
Any other questions? All right, I will jump off, but please feel free to reach out to me. I'll put my contact information, the Friends for Life information in the chat. And I'm always happy to connect with folks further. Thanks so much for having us.
Thanks, Alicia. All right, up next we have Unified. Michael Jonas, the outreach coordinator, will start off, although I do understand that there's other presenters from the agency as well.
Absolutely. Good afternoon, Barrier Busters. My name is Michael Jonas, and I'm a medical case manager here at Unified HIV Health and Beyond, as well as our outreach coordinator for the Jackson and Ypsilanti offices. About us, Unified HIV Health and Beyond, we have 3 offices, one in Detroit on Mount Elliott Street, one right here in Ypsilanti at 2287 Ellsworth, and then we also have an office in Jackson. We serve 11 counties in Southeast Michigan. An interesting fact about our agency is everybody in the state of Michigan that is living with HIV, 63% of them live in one of the 11 counties in Southeast Michigan that we service. So we're proud of the fact that we help a lot of people who are living with HIV. We also have many other services that we're actually going to review today. Do remember our office here in Ypsilanti is right on Ellsworth Street. We're right next to Ypsilanti Family Pharmacy, right almost at the corner of Hewitt and Ellsworth, right here in Ypsilanti. So we're going to start. We're going to hear from presenters today from Unified, from Case Management, HOPWA, which is our housing program. We have a prevention specialist as well as a harm reduction specialist that will be presenting, so you guys can get an overview of all the services that we offer out of this office. Okay, again, thanks for being here, everybody, and thanks to my team for participating. We're going to start today with our case manager, Alexa Bartha. She's a medical case manager here out of the Ypsilanti office, and she is going to go over all our care services. Now, our Ryan White B program is designated for people living with HIV to give them case management and support and all kinds of other things that we do for our clients. So with that, I'd like to introduce again, Alexa Bartha.
Michael, do we have the PowerPoint to show?
Don't you?
No, you have it to just,
Yeah, I thought that you had it. Yeah, you had sent it to me. I'm not sure
It's
how to do
okay.
that though.
no, you're totally fine, Michael. We'll work
Which
it
one
out.
is it? Real quick, which one is it? We'll see if we can pull it up for you.
It should be the one from, it should just be called like Unified PowerPoint,
Case
nothing
management.
crazy.
Case management and HOPWA, Stacy. I believe I forwarded that to you.
Okay, we'll see if we can get it rolling. You go ahead and start, and we'll see if we can get that put in. Thank you.
Yes, okay, I'm gonna pull it up just to get it all on my end too, really fast. So for those who don't know me, my name's Alexa. I'm a medical case manager over at Unified. So a little bit of guess what I do is I work with all the clients who are considered medical and non-medical. So I assist individuals living with HIV to ensure that they're really linked to and remain in care. So a lot of that has to do with the treatment aspect of HIV. A lot of the time clients come to us, they may not have ever been on medication, don't know how to go through the system, all of that. So I work on helping them get set up with PCP, which is their primary care physician, and an infectious disease doctor, and start the medication regime and all of that. Another big part of what we do is insurance. So making sure that they are covered with insurance. Medication for HIV is extremely expensive. So we do work with MyDat, Medicaid, and all of that stuff to make sure that they're fully good with all of their medication and all the appointments. I also work with like dental and optical services, food, a lot of behavioral health services, transportation, anything that can kind of help them to stay undetectable and to just keep living and help them to become educated and all of that. Next, we will be talking about the HOPWA program, which works a lot with medical case management. So if Summer wants to continue to talk a little bit about HOPWA, we can move on to that.
Okay, I'm going to introduce our housing specialist for the HOPWA program. HOPWA stands for housing opportunities for people living with HIV. And I'd like to introduce Summer Burrell.
Hi, everybody. I'm the HOPWA specialist / housing case manager for Unified. So what I do is usually get a referral from the housing case manager for identified housing need. So I follow up with the client, do the housing intake, and then based on the funding and the client situation, open them up to the appropriate program, which can be the TBRA program, which is our long-term program, a minimum of 1 year, but based on assessment at the end of that 1 year can be extended to a second year. And so over the course of that time that they're receiving the rental subsidy, they're working a housing plan. It goes by the typical HUD standard 70-30. If they have an income, if they do not have an income, it's not going to stop them from receiving that subsidy. However, again, the conversation around that is that our subsidy eventually ends. So the point is to have them in a better position financially, with medication compliance, stability, and all of that. So moving forward, the goal is to maintain that, right, for overall better health. So that doesn't exclude them from receiving that subsidy. So the units have to meet the fair market and rent reasonable standards, and it includes both the rent and the utilities in that subsidy. So we also have the STRUMU, which is our short-term program, which is again that 70-30 and must meet HUD standards with the FMR and the rent reasonable. Again, income standards, if they don't have an income, it's not going to exclude them from that program. And the allowable costs are application fees, one-time utility connection fees, and it cannot exclude, or it cannot be a total of the security deposit and the first month's rent. It cannot go over 2 months of the total rent. It's 147 days or a total of 3 weeks. And again, they work the housing plan over the course of that assistance as well. So we also have a program which is PHP, which is application fees and first month's rent. And again, it must meet the rent habitability standards and HQS standards. The counties we cover in housing is Jackson, Monroe, Washtenaw, Lenawee, and Hillsdale counties. Any questions on that?
Thank you so much, Summer.
Sorry, Summer, I have a quick one. I apologize for interrupting, Michael. Could you talk
That's
a bit
okay.
more about a timeline on the tenant-based rental assistance? For how long would that be possible for an individual?
TBRA is a minimum of 1 year, and then they're reassessed at that 1 year and based on health, income, kind of what the overall situation looks like. They could be extended for another year, but we never guarantee that second year. So we always say it's, 1 year, and then based on the situation, it could go for another year. But STRUMU is strictly 147 days and can exceed that.
That's really helpful.
And then
Thank you very much.
with PHP, it's just that obligation of the application fees and that first month's rent. Once that's done, that's closed, and then they're opened up to whatever the short-term or the long-term program is that they're appropriate for.
Thank you.
Thank you so much, Summer. Okay, put yourself on mute. Next, we have our HIV prevention specialist, Sam Beccarilla. Take it away, Sam.
Alrighty, so as Michael said, my name is Sam Beccarella, and I am the prevention specialist here at Unified. And let me go ahead and share my screen here. There we go. Are you all able to see it?
Yep.
Yes. Okay.
Yep, looks great, Sam.
Alrighty. So this is Unified Health and Beyond, and I will be going over the prevention services that we offer. So first is our main one. So we do testing here for HIV, Hep C, syphilis, and STIs, including gonorrhea and chlamydia. And we also are available to book appointments online. And then over here is our website, which is miunified.org. And then so Hep C and HIV, we do rapid testing, which can take 15 to 20 minutes a test. And then syphilis is a blood draw. And then STIs, we do rectal samples, urine samples, and throat swabs. So those are our services for that. And then other services that we offer, we work with PrEP navigation. So PrEP stands for pre-exposure prophylaxis, which is a protective barrier for your body to not acquire or transmit HIV to other people or other partners. And we work with the local health department here, Washtenaw Health Department, to send clients over there to start their PrEP navigation. And we work with Wolverine Wellness at U of M in Ann Arbor as well to set that up. And we also offer lubrication, both silicone and water-based. And those who don't know, water-based will work with condoms and silicone will not work with condoms. So then we also offer free condoms, which is also nice because I believe no one should have to pay for condoms. So that is a good thing that we offer. And we also do female or internal condoms as well. And we also have health literature here if anyone is wondering or wanting more information on that. We have information on smoking and living with HIV, teaching teens about HIV and STIs, symptoms of STIs, healthy relationship information, and Hep C and HIV testing information as well. And so next, here are a couple of our projects that we've been working on. So our main one that we have right now, we are providing self-testing kits for HIV to people, and we also can have anyone order it online, and then we will ship them out to you. And all we need back is a slip with your results, and then we also have incentives for those. They're first come, first serve, but it's a $10 food gift card if you do send back your results to us. And you can also find us at local events. We're all around here in the 11 counties that Michael said. And so we will actually be in Adrian tomorrow for the Day of Hope. We will be doing testing and other services that we offer here at Unified. And we're also in at Palmer Park in Detroit every Friday in September, besides this first Friday for the holiday. But we do testing there and offer all of our services as well. And then we'll also be at Lenawee Pride in Adrian. So feel free and come out and see us. And we'll have our mobile unit there if you can see it in this picture I have for you. But yes, and then lastly, here's our contact information for those. Here, Leon Golson, that is my prevention manager. And then with his work style and email, and then me. And then you can call us and go ahead if you would like to book an appointment for testing, or if you just want to work with us to kind of see where you can admit yourself for prevention. And if you need condoms, lube, self-testing kit, you can definitely reach out to us too if you have any questions. But yeah, that is the prevention side of things, and I would be happy to answer any questions if you have them. And I'll put the contact information in the chat as well. Thank you.
Any questions for Sam? Okay, great job, Sam. All right, next we have Hunter Spice Whitaker. He is our harm reduction specialist here at Unified. Go ahead, Hunter, you're on.
Can everybody hear me okay? Thumbs up, awesome. So I'm the harm reduction outreach coordinator through Unified. And I have a couple slides. Let me share my screen. All right, is everybody seeing this? Cool.
Yes, Hunter, it looks great.
Awesome. So an introduction to harm reduction. providing real-life solutions and education to reduce the harmful effects of overdose, the spreading of disease, and to mitigate all other risks associated with substance use. What is harm reduction? A set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. Harm reduction is also a movement for social justice built on a belief in and respect for the rights of people who use drugs. A public health approach that focuses on mitigating the harmful consequences of drug use, including transmission of infectious disease and prevention of overdose, through provision and care that is intended to be free of stigma and centered on the needs of people who use drugs. Through our program, we offer our syringe exchange, syringe service program. We offer case management. We have one case manager, and she can do housing. She can do pretty much all of it. We offer support groups and therapy. We just hired a therapist. We also do recovery coaching, and I'm the recovery coach. All of this is not billed through insurance. It is very discreet, nothing out of pocket. It is all free. Research shows that new users of syringe service programs are 5 times more likely to enter substance use treatment and about 3 times more likely to stop using substances than those who do not use the programs. I would also like to highlight that we don't focus on an end goal, which would be stopping or abstinence. We just want to support the health of our participants. That is all we focus on. And anything that comes after that is extra. So if somebody wants to come to me for recovery coaching, that is awesome, but we do not push that in any way. I have a chart here that shows from 2018 to 2021, we have a rise in opioid overdoses, rise in fentanyl overdoses, and a small decrease of heroin overdoses. The large opioid overdoses would be like xylazine, which is a new form of opiate. But fentanyl is definitely getting up there. I'm sure everybody's heard about it in the news. We have Narcan, which can reduce the overdoses. And we also have testing strips for fentanyl too, which we just got in. This is a little bit about Narcan. Naloxone, also known as Narcan, is a safe and life-saving medication designed to reverse an opioid overdose. Opioids cause death by slowing your breathing to the point it stops. Naloxone can quickly reverse this effect and helps the person to breathe again. Delays of only a few minutes may mean the difference between life and death. Naloxone is available as both a nasal spray and an injectable. We give that out for free as well, which is very important. Harm reduction works. In 2022, the Unified Organization provided the following services. 29 clients received case management services, 3,689 fentanyl test strips distributed, 636 Narcan distributed, 128 overdose reversals recorded, 1,985 hygiene kits distributed, 4,204 harm reduction kits distributed. These are some quotes from our participants that have lovingly put in the notes for their supply sheets. I'll leave that up. And if anybody has any questions or comments, open to that right now. And I will also put my email and contact information in the chat. I don't know how to stop sharing.
Up at the toolbar, up at the top on the right side.
There you go.
I think I did it.
Thank you.
There you go. Thank you so much, Hunter. Okay, I want to thank again my colleagues for their wonderful presentations. There are a few other things I want to make sure that the Barrier Busters community is aware of. We also offer tobacco services to anybody living with HIV with a tobacco specialist, as well as all kinds of incentives to help reduce their tobacco use. We also have support groups for people living with HIV. We have an all-female RISE support group that meets once a month. We have a healthy relationships group that meets in cycles for 6 weeks at a time to discuss any HIV-related things that people may be experiencing. And out of our Detroit office, we also have a Free to Be Me reentry support group. That's the reentry program that anybody returning to society from being incarcerated and living with HIV, they can go through our Detroit office to help them get reestablished. So those are the support groups. We also have a systems navigator that can help with all the insurance needs as the ever-changing insurance world goes about. So as people have insurance needs, we do have a systems navigator that can help them with that. We also have a text to treat program, which actually is a text reminder that people living with HIV can sign up for to get a text daily to remind them to take their HIV medication. And that can be very helpful at times. Okay, that's really an overview, and quite an overview, of what we do out of this small office. We offer a lot of services. If anybody has any future questions, I want to let you know our office number is here in Ypsilanti is 734-572-9355. You can call and ask for whatever department you'd like. We also are manage the Michigan HIV STD hotline with a number of 800-872-2437, where you can call about texting or other information about sexual health resources. Okay, I think that pretty much covers just about all we do here at Unified. We could have forgotten a lot of things. I want to thank you guys in the Barrier Buster community for all the work that you do to help our vulnerable populations here in Washtenaw County. And feel free to reach out to us at Unified if we can help in any way. And of course, anybody living with HIV, working with prevention or harm reduction, anything at all, please send them our way as far as community members, and we'll be able to help the best that we can. Does anybody have any other questions or any comments that they would like to?
Yes.
Hi, go ahead.
We have Christine who's asking, would you recommend that standard emergency safety kits should include the Narcan?
That's for Hunter. Go ahead, Hunter.
Yes, 100%. I'm actually trying to see about getting free Narcan vending machines. I know that a couple organizations around the several counties bordering us have opened up free Narcan vending machines in libraries. But yes, I believe that that should be distributed widely.
Thank you. We also have Sheila who would like real quick if everyone for you to put those numbers again in the chat. I also think too, Sheila, if you scroll up, you might be able to catch their numbers and contact information.
I'll add the Michigan HIV STD hotline number to the chat too, that you guys can give to other people for other questions about anything through sexual health resources. Any other questions?
Yeah, I'm not seeing any more in the chat. Thank you.
Great. Again, I want to thank you guys very much for having us, and again, for all that you do for our community.
Thanks so much, folks over at Unified. So last thing on our agenda is just a funding update from the Barrier Busters team. As you might recall from previous emails, we did a whole heck of a lot of assistance during the first 4 months of the year to the tune of basically what our annual budget was for all of 2022. And so we continue to be a little bit cash poor as far as our different funds. Right now, we don't have any countywide available funds, although we do have specific buckets that focus on the Pittsfield Township, and the City of Ann Arbor area in particular. Come hopefully the beginning of October, Ypsi Township has been kind enough to provide us a total of $450,000 from their ARPA funds for the years 2023 and 2024. So we're going to be dividing that in half. And don't worry, I think that we'll actually be able to easily spend $225,000 in the remainder of 2023. But be on a lookout for that fund availability in the coming weeks. And yes, is there any questions about our current funding availability? Okay, seeing none, we'll thank everyone for attending today's meeting and hope to see you all at next month's meeting too. Have a good one, everyone.
Thank you
Thanks,
so
guys.
much, everybody.
Thank you.
Thank you, everyone.
Thank you.